Developmental disorders in children, attention deficit hyperactivity disorder. What is attention deficit hyperactivity disorder, or ADHD? The core symptoms of ADHD are inattentiveness, hyperactivity, and impulsivity. These symptoms cause difficulties in learning and interpersonal relationships, which may lead to emotional problems or low self-esteem, resulting in significant functional problems. What causes attention deficit hyperactivity disorder? Research has demonstrated that several important areas of the brain are differently activated in children with ADHD. These include the prefrontal regions, the basal ganglia, and the cerebellum. Since areas of the brain responsible for executive function are affected, children's attention, control of behavior and emotions, working memory and organization skills will be affected, resulting in manifestation of ADHD. The exact cause of ADHD has yet to be elucidated. Research has demonstrated evidence to support its hereditary nature. Maternal smoking and alcohol intake during pregnancy, prematurity, and low birth weight. History of encephalitis, lead poisoning, abnormalities in metabolism, epilepsy, and brain injury have been shown to be risk factors for ADHD. Although biological factors play an important role in the manifestation of the condition, psychosocial and environmental factors, including family support, school accommodations, and societal acceptance, are crucial in affecting its severity and its impact on daily functioning. How does attention deficit hyperactivity disorder affect children? Clinical features of ADHD evolve with the children's age. Infancy and preschool age. The core feature of children with ADHD during this period is hyperactivity. They are energetic and are often running about or climbing. Some children may cry and lose temper easily. They may have greater emotional response to events and become excited or angry easily. Some may have sleeping problems as well. School age. During this period, problems related to inattention will become increasingly obvious. Children may have difficulties in learning. Their inattention in class may affect their classroom and academic performance. They are impulsive, weak in self-control, and non-compliant, leading to problems in social relationships and conflict with peers. Some children may also show oppositional, risk-taking, or dangerous behaviors. Late childhood and early adolescence. Although the severity of hyperactivity may decline in this stage, features of inattention and impulsivity often remain. New areas of potential problems may emerge, including frequent engagement in interpersonal conflict, fighting, or substance use. Adulthood. The core symptoms are inattention and impulsivity in this stage. Adults with ADHD may have difficulty concentrating at work. Symptoms of distractibility, disorganization, inefficiency, impatience, and impulsivity may persist. How to help children with attention deficit hyperactivity disorder. The treatment strategies for children with ADHD vary according to age. As shown from numerous international studies, medical therapy and behavioral therapy are proven to be effective strategies. For preschool children under 6 years of age, behavioral therapy is recommended as the initial treatment. If the child's condition does not improve with behavioral therapy, medical therapy may be needed. For school-age children aged 6 years or above, and for adolescents with more severe symptoms, medical therapy is the first-line treatment. Medical therapy is very effective in controlling the core symptoms of ADHD, improving attention, and reducing hyperactive behavior. While behavioral therapy and educational support will improve learning and reduce behavioral problems. What is the outlook of children with attention deficit hyperactivity disorder? Research has demonstrated that the symptoms of ADHD persist to adolescence in 80% of children and to adulthood in 65%. The extent to which an individual can cope in daily life and in choice of occupation depends on many other factors, including the severity and type of symptoms exhibited, the severity and number of associated conditions, the individual's intelligence, the family situation, and treatments received. Early identification and intervention is very important for children with ADHD.